technology, can happen with you with your student as well. So what I'm going to do is that, how do I do it? Clinical visual teaching using the magic pen. I am not a medical educationist, but what I'm trying to share is that the trial and error teaching, virtual clinical teaching via Zoom. So that, can I move to the next slide? Right. Why do I do it? Next slide, please. Right. It's basically out of necessity. Because as we know, students being restricted from going to the clinics, they absolutely have no contact with the patients, and we can't do anything with the student for the last 3 months. So we were out of depth on how actually we're going to give at least some clinical exposure to the students via the virtual teaching. And then the second thing is that during the first few months of the MCO, we were at loss on how to move on. And at the same time, we need to keep the students in their toes. And the posting still in progress, even though we are at the MCO. So that's the challenge there. And clinical teaching is one of the components for family medicine teaching, and maybe also the components of many of the other teachings that the student has to go on. So that is the drive for us, for me, to find a way that I can connect with the student with whatever that I have in front of me. Next. Right. First of it that we did is try and errors. What works and what don't. The first one is the usual face-to-face session in the clinic. Obviously, this is the best method that include observe and teach, mini CEX, interactive clinical teaching, or group teaching. But it cannot be done because of the MCO. The second thing that we tried, or I tried, is using a case scenario discussion via Zoom. The first time that I tried it is like providing a case, or vice versa, of the student providing the case, the student participate. It reached the objective, but only the handful participate. The rest would unstable internet, and you feel like you are talking to the wall. So it can be done, but most of it that you feel unsatisfied because you are either talking to yourself or talking only to few of the students. I also tried Kahoot method, providing quiz and ask students to participate. It is a fun method. It's interactive for students. The student will try their best to beat each other up. But the first thing is that it needs skills to prepare the quiz. And the free of charge program are limited. That not much subject methods that can be put into. Basically, it's either choose one or your rating to the multiple choice that you can give. You cannot put options. You cannot put subjective writing into that. So Kahoot is a good method. It might be a good to start interactive session for the student, but it cannot be done as a full clinical teaching. But as I said, this is from my own experience. Can maybe somebody in the participant have other experience in it. The next one that I did was standardized patient with mock case clerking. This is the next best thing to face, meaning that what we did is that we have a standardized SP either in our clinic or in the room, and the student try to clerk via Zoom method. They ask the question to the SPs. Nonetheless, it's only effective if being done in open setting rather than virtual. Again, the talking to the wall effect will come in because only a few of the students will ask the SPs, and the SP will try to answer the one that is scripted, not much than that. So again, there is not much interaction. Let's say that if you have 45 students in your group, maybe 3 or 4 that only answers to the question, or maybe trying to participate in the teaching and learning activities. The next thing is using a pre-prepared case to initiate discussion, but using virtual setup lead to one-sided question and answers rather than discussion session, because using pre-prepared case is by using virtual only one-sided question and answer, because the student will try to answer, but you trying to give the answers based on what you have prepared. So for all this method, what we have is actually aspiration and despair. We cannot do much, but we need to teach the student. So what I did was, next slide. So what a teacher needs in virtual clinical teaching is commitment from students. We need that. The second one is to do two-way communication. The third thing is able to see the student during the class, able to see the student to write, to talk to you, communicate to you. And the fourth one is students to participate and asking questions. The final one is a fun but productive session. It's just quite a high task, but I think that is what the student wants. I think the current generation, they want a fun, productive session. They want to participate. They want they want to call away communication, but they don't want to see you. You want to see the student. So my first tip is that you need to see the student. Ask the student to show their face of however unstable the system might be. The next one, I hope So what actually happened during clinical virtual class is that is have a one-way communication, is mini lecture rather than case discussion. What usually happens, student might select cases that are too easy or too complex. The objective might not be met, and there would be lack of interaction between teacher and student. So this is what happened between teacher and student. So how do I do it? The next one is need to find a middle way in the form of more interaction, dynamic, but at the same time looks cool to your student. That's most important, to look cool in your student. So what I did is that using the one that I have, the trusted tablet, the pen, and also a website, some of the websites that are good for you to get how actually teachers outside there teach their student and adapt to our current situation. So it's technology and knowledge. It's not technology versus knowledge, but it's technology and knowledge. So the next one, I hope it works. So sharing my experience using tablet and pen in teaching visual class. This is what I do, is that using a pen and this tablet to actually be in communication with the student. All right. So the next one. So, okay. Right. So what I did is that I will stop here, Tong, because I think the one that I prepared is not the same. I'm going to share with you what I did with the student in actual teaching, so that we can have the sense of how it is being done. Can you bear with me to get the lecture?
Yep, no worry.
Yep.
Hands up,
thank you very much.
Thank you.
Yeah, it is a sharing experience. Okay, any questions while I'm searching for the one that I actually teach the student? Anything? Anybody want to share, or anybody want to ask up to now? I'm okay.
Yeah. So while you're waiting, and yeah, that's great, because there are three things to be talked about in active learning. There's pedagogy, which is the way how we teach, the principle behind, and technology use, and the space. Space is digital platform, and of course technology. You've been trying to, of course, you're going to demonstrate how technology.
Yeah. I'm looking for the case now.
Yeah. Okay. Let's look at the chat box. Yeah. If you need time, you can put in a chat box. Okay.
Okay. Is in the tutorial. So what we did was, the thing is that I don't know what happened to the tablet today. Everything is lost. So all right.
I would interrupt you because you're busy looking up and sorting things out.
Yeah. Right. It's here now. It's downloading. It's now trying to connect it to Zoom. Yeah, I'm connecting to Zoom now. Set to ongoing meeting. Yeah. Okay, we are here. So this is the tutorial, one of the tutorial that I shared with the student. So it's a tutorial of clinical teaching. So what I have is actually a real patient. So I asked the patient, imagine you are in the consultation room. So I give the sample, Miss KH, a 25-year-old investment analyst, come to see you, requesting an MC today. She complains of the headache since Saturday. So I give the student, okay, this is your patient. So I put a patient face to give the feel of the student of what is going on. So the next thing is that I'm asking them, something is very wrong with the. Okay, how would you proceed with consultation? So how would you proceed with consultation? I will ask them to shut out the history. Okay. Shut out the history, and then the next thing is that I give a multiple color of what the history they are talking about. Let's say the first student Anis. So I ask them what history you are asking. The second one is Aiman. The second thing is what actually you want to ask the student. All right. When is that? And then I also use the whiteboard. The whiteboard is inside your tablet or inside the Zoom, so that what you can do is you can put the history, number 1, number 2, number 3. And then from the history, what you do, you ask them to elaborate. You ask them to elaborate some more. If they are doing it right, what I did is actually putting a good one. So then I'll move on using the red pen to put on, this is incorrect. Why do you think this is not correct? Put it some more. So in doing this, what I felt is that the student like, because they will put a lot of information and it is dynamic. So when there is when I'm before I move to another whiteboard, I ask them to take a picture first. Now you take a picture, because the next thing what I did is I'm going to clear this and then I'm going to off the whiteboard. When I off the whiteboard,
yeah. You're not showing your whiteboard. Is that you're trying to show us your whiteboard?
The whiteboard will come in the Zoom or in your tablet.
I see. Okay, because what we are seeing now is your slide on tutorial 5, year 5 Eurocut. So, yeah. So, it's big. I do not know. My side is okay, but it is being lagging. Even your voice is lagging. Okay.
Yeah. All right.
Okay.
All right.
Anyway, basically what we gather is you ask the student to come up with some, potential question that they want to ask and clarify, and then you will respond by giving immediate feedback.
Yes.
By checking whether it's right or wrong. Okay. All right.
Yeah. Right. So and then the next thing is that for the students to use for you to use whatever the student put in the question and answer session, so that it will come back to them in a points that they understand. So and then after that you can proceed with her story, meaning that how is she getting on, and then you go back to what more you need to ask now. You ask more question and you put some answers in that. You ask more question, you put some answer. You ask more question, you put some answers in that. This is what the thing that I did with the student, so that the student now engage, because they do not see what happened after that. They have to give input to the clinical teaching, so that they will need to move on to another slides. So the next thing is that I will move on to physical examination. And then again, from this, we move on until we got to the end of the consultation. I am so very sorry. It is not working. I do not know why, but actually this is how I do it, and it works well. during with the student, because they have to really participate in the discussion. So that I think I should yeah, this is what we did. And then again, and at the end, we will ask the student to actually reflect on what you have learned and what you can bring to the practice. If I might stop sharing and share back the discussion with Prof Tong.
Yep.
Just now.
Yeah, I guess let me share where we left off. So in the sense that student actually who writes on the board, I mean, the student will shout out the answers for us to direct feedback. And is that a slide that you intended to share? Correct?
Yes, correct. Now it's go in. Thank you, Tom. So this is what happens. So the student will give the answer, and you would write the whatever history responses at the whiteboard in your tablet. So it's like you are teaching with the student in front of the student. Next, now it's come back. Right. So now the patient, imagine the patient. He will you will give some more information to the students, like what is going on next, and then you will ask the next question to the student. This is a different case, and then continue the same method in physical examination and problem list. Give a little clues and ask them to respond to the clues. All right. Sometimes you write a little bit, and sometimes you have to ask what is the prioritization, patient agenda, and patient problem. Next. And then this is the important part. Sometimes you ask, do you read about, because the case that we are discussing is the BPH, difficulty in passing urine. The idea is the concern and expectation of the patient or any comorbid that might be worse, meaning that you keep the slide empty or half empty, and then you put the answers here. You put all the answers here so that the students see in which way the thinking process going on. So next one. All right. So these are the part. Keep on the class by asking them to contribute and give option and ask them to choose. Right. So ideas, concern, and expectation, and you ask them to choose your management at this stage, because in the way that I found it during the first session is to a patient with headache. If I didn't give them an option to choose, it will not give the objective you're trying to achieve by the end of your clinical teaching. So by give them an option to choose, like treat and discharge, treat and send for referral letter, treat and refer for admission in primary care. So the student will now put in their name where actually they want it to be, and they will try to answer it by then. So if you see that a lot of things going on, and the student now, that there will be interactive pictures change from the student as well. So this is what I did. Next.
So just that you need to clarify. The student has get your permission to also write. This is by Zoom, so they were going to write on your board. Some
of the students will have the iPad. You might be surprised, they are more actually more advanced than us. So they will write as well to what they think it is their ideas and their expectations. So they will be, or they will shout that to their friends to write the discussion. And at the early discussion, I will put them also in the breakout room to discuss about the case as well, so that they will now actually put in the breakout room, because there are too many of them, sometimes 20 or 30 of them. So put it in the breakout room, ask them to discuss, and come back to you after maybe 5 or 10 minutes, so that they will be a focused discussion and actually keep them engaged during the virtual clinical teaching. So next one. So at the end of the class is that the conclusion of what they learned from the case. I found it very interesting, because during the first 1 or 2 times I did with them, with no conclusion, right? The student might not be alert of what they actually have to learn back at home. So with the conclusion, the first one is the theory part. what actually they learned from the case, what actually they wanted to know more after this, and then whatever values, like let's say in family medicine, primary care values, and then primary care approach. Maybe in surgery, the surgical approach or surgical values or surgical technology, maybe things like that. And the last one is to look back at the reflection. Reflection is very important. Is that for the student to reflect back on themselves, what actually they actually good at their strength and their weaknesses too. And maybe I also reflect on myself as well. I said, maybe I am too fast with differential diagnosis. I said, maybe, we are looking into too many differential diagnoses. It's not focused. So we learn together at the end of the clinical session. Usually a good clinical session would be around 30 to 45 minutes, not more than that, because if more than that, the concentration focal will be lost. The second one, like us, the internet connection would be unstable, because that is how long the student have usually with us. So reflection on their study process and summary of points to bring home. Next one. So in conclusion, like we experienced just now, using a Zoom or any clinical teaching, it is might not the best way of clinical teaching. Sometimes you have to have plan A, plan B, plan C. Like what I have just now, I have to look for something to fill up the gap if the plan A did not work. But the most important thing is to keep the student engaged and to keep the two-way communication going on. The second one is that, nonetheless, the virtual teaching at the moment, by using interactive session, by using pen, maybe by using the student to write it back to you during the class, it may fill the gap of virtual class teaching. It might not replace the actual teaching, but it may actually give a virtual class teaching. Tom, can I share from the beginning the reference that I get to get the cases for the virtual class? Because actually I found it during the time where we did not have anything to go with the student. There is a website that's called Ukm if I may write here.
You want to write?
Yeah, no problem. Can you see?
Yes.
All right. Okay. Thank you. All right. Geekymedics.com. Geekymedic.com is actually a website that looks for medical students.
Kau jangan cakap kau
this is when the students write back that look into physical examination, case presentation, clinic history taking, investigation, and quizzes. And this I often ask the student to it so that they will have a follow through after the session, and I also look into that as a guideline to do the virtual clinical teaching with them. Why? Because there's a segment by segment that the teachers in Wikimedics looks into, that focus on, that you can also base it for your student. This is what the geekymedics.com look at it, because it's actually give you an idea of what people in other country or other part of the world are doing with clinical teaching. So this is how we use the pen and tablet with the student. Right now.
Just erase it.
Yeah.
Okay. Just to get, because I noticed, I experienced that writing with electronic pen may not be appearing very well. Anyway, this GEETY, is it?
Yeah.
GEETY. Okay. Right, open for discussion. I think you've done a lot. You have done a lot with that session. You spoke about experiential learning. You put up pictures, isn't it? That's quite engaging. Yeah. I won't be asking any question. I open the floor for any question, and basically the use of tablet whiteboard as your interactive platform.
Yeah.
Zoom. Okay. Yeah. Invite any discussion. I will stop my screen sharing. So yeah.
Hi, Professor. Teh here.
Yeah.
Just one. I don't have iPad or pen,
Yeah.
So if for those who don't have iPad or Apple Pen, I mean we can still use the whiteboard with our laptop, right? I'm just not
Yeah.
very familiar. I mean, it might not be as good, I guess. What do you think?
Yes. Yeah, it might be not as good. That's why today I've tried to use the tablet. When you use the one that in the your laptop, it can be used with your pen, but it is either lagging or it can't be. You cannot write a lot in the whiteboard. You cannot write a lot, but you can type on it. You can type on it. So that's the difference.
Yeah.
Yeah. Uh, Usually what I did is that some of the students have their tablet, so that they work in the groups, or they would shout I will also use the chat group, the chat at the participant, so that I will shout the question, and they would type it there, and they will put that into the whiteboard, because what I felt is that when they put in the chat, you cannot grasp all of it because it's moved rather fast, and then it cannot be, you cannot put it in the list, so that is the use of whiteboard during the clinical teaching.
Mm.
Mm.
Okay. Yeah. Sound like interesting thing that's I just picked up. You've done well. I mean, that you engage student in thinking. So a lot of thinking, a lot of quiz, and that's very active in the learning. So that is deep learning, and that's hopefully student will remember the experience much more. Yeah, and use
Yeah.
quiz. Yeah,
Yeah.
I like
You
yeah.
you can start the session with Kahoot for maybe 1 or 2 minutes to get them started. Like I mentioned, is that Kahoot is if you do the free of charge apps, only a few that you can doodle, can tweak with it. So start with Kahoot, and then the case study, and then put a gap in between, and then throughout the 6 or 8 months of doing this, I now evolved towards giving an option for ask them to work on the option, because if I put everything in a subjective manner, what happened is that I could not finish the clinical teaching on time, because it will go everywhere under the sun, and then some of the students also might lost during half of the clinical teaching. So that by putting an option, by putting some structure to it, so that the student and you yourself have a directive, a good direction in your teaching and learning with your
Yeah.
students.
Somehow
Yeah.
positive thing is having a reflection at the end summary.
Yeah.
Like
Yeah.
this is where the debriefing and ask patient and student to reflect what have they learned, and their
Yeah.
answer might prompt us where the error, their learning
Yeah.
will happen.
Yeah.
Correct.
Yeah. Yeah.
Yeah.
The,
So
the first
yeah.
the
Sorry.
first one, that when we did the reflection, is more of reflection of you not actually engaging with them, so you have to be open-minded, and oh yeah, so I the maybe the font that you written in the whiteboard is maybe they cannot understand, or it is might be too fast for them, or the cases are too easy. So it's a good reflection actually to the students and the teachers as well. You are learning during the process.
Sure. Sure. Any more questions and query and clarify, and it looks like a simple way of doing it. Engage part.
That's why I'm quite reluctant to share, because I think it's very, very
Nope.
simple.
Yeah, simple but necessary is non-effective because the engagement of the way of teaching, the active learning principle are all built in. So that's where the effectiveness of teaching, not necessarily have, a lot of sophisticated tools, but sometimes simple tool, but engage with the principle of learning, the pedagogy, so to speak. No big terms, but no, yeah, big term. But I guess you've engaged all that cycle of learning. So it's
Yeah,
not
we
very
tried to.
difficult.
Yeah.
So that's great. Any other question? If not, we will move on. Now it's 3 o'clock, 3:05 already, but you can still type in a question if you like. No pressure there. Must be a sharing experience rather. So the next is Dr. Tay. Dr. Tay going to demonstrate to us how they use DXR clinician, and how would that help student learning. Yeah, Dr. Tay.
Okay. Thank you very much, Prof. Kong. Assalamualaikum and good afternoon, everybody. So I'm just going to share my experience of teaching through DSR clinician, and it's I'll just in my presentation I'll show what is actually DSR clinician for those who are not familiar with it, and then I'll just show actually what we do in our department. Okay, I'll just share my screen. Just bear with me. Okay. Can you see my screen?
Yes, thank you.
All right. Okay. All right. So this is a sharing session on this software that the UKM Medical Faculty has actually purchased. So it's actually available to be used for among the lecturers in the medical faculty lah. Whether we use it or not is a different story. But I'll just show you how we actually do it in our department. Okay, so this is what I'm going to talk about in this short time. I just kecilkan. Right. So I'm just going to briefly talk about what is the DSR clinician software and what does it actually look like from the student's point of view. I'll be sharing a few videos that I made just for this. And then I'll just show how we actually do it, and also I have a little bit of feedback from students, so I'll just share that as well. So okay, so what is DSR Clinician? So DSR Clinician is a virtual patient simulation software which is created by the DSR Development Group Incorporated based in Illinois, USA. And like I said before, the Faculty of Medicine, UKM, have actually bought the institutional site license, and we have, it's not on a yearly subscription or anything, we have actually bought it for unlimited use, but only for, they gave us 10 different case templates. Okay, so they have, with this license, we have 10 generic case templates, but from here, lecturers are able to edit from the templates to create more custom cases. So depends on if we do it or not. So we can actually have a lot of cases based on the templates, but it needs a lot of work lah. Okay, so the objective of this software is basically to teach and evaluate clinical reasoning skills, right? And to try and simulate experience of clerking and managing a real patient by using this software. That's the objective of it. How they do it is by going through the cases that we give to them, from starting from the history, from the physical examination, from the investigation, and they have to come up with diagnosis, differential diagnosis, and also management. All these are customizable. We want it to be very simple, we can do it. We want it to be very detailed, we can also do it. Okay, so this software actually, what I like about it is because it teach students symptoms-based approach, which in our department, family medicine, we one of the approach that we teach is symptom-based. Okay, not by the disease but by the symptoms. Okay, and so just this are the templates, the 10 templates that I said that is available. So we have abdominal pain. Also, we have antepartum hemorrhage. We have most are adult cases. Yep. So we have one ONG case template. We also have a PR bleed. We have chest pain. We have shortness of breath and wheezing. We have what's this emergency. I'm not really familiar with all lah. All right, but these are what are available. Chest pain for 1 month and fatigue. Okay, and we also have fever with cough, chronic cough. We have one template for a pediatric case, 9-year-old girl with headache. We also have hypertension, and we also have a patient who comes with symptoms of stroke. Right. So these are the templates that are actually customizable. Okay. So that is briefly what is the XR Clinician software. So I'm just going to show a few videos about how it looks like to navigate through the software from the student's point of view. Okay, so just bear with me. There's a few videos here. So first of all, this is what the interface looks like for my case that I did with the students. So you can change the name, you can change the picture, but there is a stock picture that is already in the software that you can use. There's a lot to choose from. So this is what the student is going to see in the beginning, right? So I'm going to divide the videos into history taking, physical examination, investigation, and management. All right, so we start with history taking. So just have a look. You can see, Can you hear?
Yes.
So these are the cases, but symptoms that the patient comes with. This is the interface that they see first. So they can choose from a list of questions and they will have the answers there, as if asking a real patient. So they will ask you, before you can proceed, they will ask you to list down your differential diagnosis. Then you will have more questions to ask. There's prompts asking about which differential diagnosis you want to entertain. As you can see, there's a lot of questions that they can actually ask. Okay, so you can, I hope you could see the video clearly. I'm not sure the connection. So that is for the history taking part. So as you can see tadi, on the left hand side, the column, there is a lot of questions that actually can be asked. Actually, this video is one of the templates, the generic template lah. It's not the case that I do with the students. It's just one of the generic chest pain template. So so the students can choose. You can actually, as a teacher, limit the questions that the student can ask. So otherwise, they will just press everything. Maybe they won't be thinking that much. So you can actually either just let them explore, or you can actually limit the questions. Let's say 20 questions only, the most important 20 questions. So it's really up to you. So after they have done the history taking, they will proceed to physical examination. So this is the video for that. You can hear this music as well?
Yes, correct.
Okay.
Able to, yeah, very clear.
So this is the physical examination. So you can choose which part of the body and what you want to do. There's a lot of things, very detailed. So this is inspection. When you press the I, it's the inspection. You can see the vital signs. It's American, but you can customize it. Instead of Fahrenheit, you can actually change it to Celsius. So this is palpation. Percussion. So it's red. So this is auscultation. They have to press. When they press at the right area, they can hear the heart sound. So they have to interpret: is it normal? If there is a murmur, and so on. And then they can enter the interpretation. Then they will get direct feedback from a consult. So they will tell the result of the heart sound that they heard just now. Right. So these are also customizable. So you can choose other parts of the body. So you want to listen to the lungs. That's the spine. So you have to really listen. Put properly where you want to listen. So this is the lungs. So similar, you can consult and see. So no is normal, right? Just to say that actually they can press anywhere. Like for example, they want to do a PR, also can. So it might not be relevant. So they won't get any marks for that, but they are free to explore. Okay, so that is the physical examination. It's also a lot and detailed, and it's up to us to customize it if we want to. Okay, so moving on to investigation. So after they did the physical examination, they will move on to the investigations based on the case. So it's American based, so some of the terms are like EKG. So we can also take our own ECG or take from Google. You can upload it on the software. This is what is normal. They can enter their route through and they can also get results, and they will the software will tell them what is the result of the ECG. So they can compare with their own. You can have ECG, you can have chest X-ray, you can have a lot of things that is available. Right, you have also blood investigations. You can either type to search or you can go through the list. For example, chest pain, maybe they want to look for troponin. Test info is the description of the test, what's the indication and the normal value and so on. They can learn from there as well, and they can order it, and they will give you the normal value there, and they can see whether that result is normal or not. So just to show that it's very detailed, for example, if they choose this angiogram, there's even a picture of an angiogram if you want to go into that, until that detail, depends on how or what you want to do. So they have to interpret that as well. So maybe internal medicine would be more relevant to use this, maybe not for primary care so much, but it's up to us. And the results also they will give. Alright, so that's the investigation. So I'll just move on to the final one, which is the management. They're supposed to key in the diagnosis first before they can manage. Okay. However, for this case, it says that there are some interpretation that they need to do. That means maybe they did not do some investigation or So they have to go back to the history or physical examination or investigation to complete that first before they can proceed. But this is just interim, so they can choose anything. And they will ask you the indication of why they want to do that in the management. For example, this is cardiac monitoring. So what's the indication, what's the purpose of it? You can ask the student. You can either ask or you can just disable this function if you want to. It's also customizable. So intravenous fluid, what's the purpose and everything, you can also do. Alright, so that's nursing. So medication also, there's a lot. Yep, it's very detailed, right? I will talk about this a bit after this. Medication, they will ask the purpose so that the student will learn along the way. They have to think, why am I ordering this? What's the indication and all that? And the teacher can actually see what they write later. Okay, right. So those are the videos. Just briefly, just to show the function that is available. Any questions so far before I move on? In case ada.
Not in the chat.
Okay, right. If not, then this is what we see the students' marks. Okay, like I said, it's very detailed. This software is very detailed. If you can see my mouse, so the clinical reasoning. So you can set for hypothesis how many questions they should actually answer to get the marks, and so on. Just that the terms might not be very familiar with us. Maybe this is an American way, I'm not sure. So what I understand is hypothesis is the differential diagnosis that you should entertain. The diagnosis is the actual diagnosis. Justify is questions you should ask or investigations that you should do to justify your diagnosis. Competing is questions and physical examination and all that for your differential diagnosis. Thorough questions, investigation and all that just for to be complete, just for completeness sake. So it's not really that important for diagnosis, but just for thoroughness, those are the questions that you might want to set. So all this you can set yourself, right? So you can actually set, you can just want to history only, then you can just set answer history only. So they would just skip everything else straight to the diagnosis. For example, like for example, you don't want to do management because maybe third year is too detailed. You can just do physical examination. You can just do history, physical examination, and then straight to diagnosis. So all that are customizable. All this is automatically they will generate the marks. However, the things that student actually write, that one the lecturer has to go through manually, which is a bit tedious, right? And also they use the SOAP approach, which I personally do not use or teach the students. Maybe some people do. So SOAP is subjective, objective, assessment and plan, right? And even if they write here, you have to go through the results manually. So it's a bit tedious actually if you have 50 students to go through it, right? So I will show you how we actually go around this, because I think myself personally it's a bit difficult, a bit overwhelming to go through all this, right? So that's the software, right? That's what the
That's a question, Dr. Pei. 48 over 70, is that their marks? A slide above. 48 over 70.
I'm not sure. Yeah, it's I'm not sure why it's over 70. I think you can set it maybe in your own case. I think you can set to whatever I think that maybe the other 30% is elsewhere. Maybe the subjective. I'm not sure.
Oh, I see.
But I think you can set.
Un-
Yeah, because I personally actually do not actually use the marks lah, the marks that they just for rough guidance, but I don't actually ask the student to be too obsessed with the marks because we actually don't take the marks. It's just for what is important is the learning process. So I'll just show you how we go around this. But I think you can customize it to go to 100%. I think depending on your case. If you think that maybe history is more important, then you can give more marks. The weightage will be more there. So all this also customizable. Okay. So this is how we do it in our department. All right. So family medicine department initially adopted this software in our teaching and learning method in March 2020 during the first MCO, like Prof. Azhar just now. We had to do it because of necessity. So happens to be that this software was available and we were just learning it, so we thought we might as well just use it. So it replaced clinical teaching sessions as students couldn't go to the clinics and see real patients. So we decided to use this during the MCO just to at least they have something for them to actually learn about history and physical examination, not with real patients but with a virtual patient. So we actually used it for both year 3 and year 5 undergraduate medical students, but with different levels of expectations. So for example, for year 3, we only like do it until investigation ataupun just until physical examination, and then straight away to diagnosis. We do not expect them to go into a management, but for year 5, we do expect them to manage the patient lah. So we came up with five customized cases based on the 10 templates just now. So we had 4 adults and 1 pediatric case, and students were given 1 week to attempt the case because the students were there for 5 weeks. So each week they had 1 case to attempt, followed by an online face-to-face session at the end of the week by the respective lecturer. So we actually combined, not just, we felt that just by using this might be because it's new both for the students and also for us. We're not really sure whether the students can actually benefit that much or it might confuse them more. So we actually arrange for a feedback session with the lecturer to discuss the case, so that if there is any uncertainty, then they can ask during the session. And so we combine both methods. The discussion of so the face-to-face session, actually we discuss the details of the case and sharing of the marks. Some lecturer actually share the marks. They go through it and share the marks and how it is marked, but not all. Okay, so it's up to them. So there's five of us. So how do we share it with the student? We actually put the cases on UKM Folio. Okay. So when they go to UKM Folio, they will see this section. First, we gave a short video on how to navigate, how to log in, what password, how to use a password, and so on. Just very brief. And then these are the 5 cases. So the first one is actually an adult with body weakness. Second one is what I did, adult with fever and cough, basically talking about influenza-like illness and pneumonia, right? Third one is a child with prolonged cough. Actually, this child has asthma. Fourth one is an adult with chest pain, right? Fifth one ni tak ada gambar, but it's an adult with PR bleed, right? So these are the 5 cases that we use for the students during this period. And these are the lecturers from our department that are involved: Dr. Izura, Dr. Tanmi, Dr. Fairuz, Dr. Sahar. So we were in charge of the cases, and we were assigned to do the feedback sessions with the students at the end of the, my time is, okay, just quickly. So this is sharing how my feedback session. I actually use Pear Deck from Google Slides, and I actually use the Microsoft Teams platform. Why I use Pear Deck, if you're familiar with it, is actually interactive. If it's just talking, like Prof. Azhar said just now, you'll be talking to yourself most of the time, or one or two students. So PEDAC, the student can actually, you ask them to log in, give the password, and just ask these triggers, and they just type in with their device, and the answers would come. Everybody can see it real time. So if they're typing one by one, you can see. If they delete, you can see. So it's just a trigger for me to discuss further with the students for further discussion of the case. So what are the relevant history, physical examination, investigation, differential diagnosis, and so on. And instead of just typing, you can also like ask them to drag. For example, how would you manage this patient? Would you admit or treat as outpatient? They have to decide, and they can drag the icon to admit and so on. Then you can, it's a trigger for discussion. That's how I do it. And right, so that I'll move on quickly to the feedback, because if you can see here, after each each case, there is a feedback form. So each case had feedback form, so for our own benefit as well, for us to improve. So these are, I'm just sharing some. So this is what we ask. At the end, how would you rate this session? So clarity, user friendliness, difficulty, relevance, meeting your expectation, contribution to knowledge, contribution to skill. So so as very briefly, as you can see, user friendliness is not so much compared to the rest. The rest, this yellow one, satisfactory, is lower, but for user friendliness, the very good and excellent is not so high. So I think the students did not find it very user friendly, a bit fiddly maybe, yeah. And then also contribution to knowledge, I think more compared to skill. So they might feel that it's more beneficial for the knowledge instead of skill. Right, so some questions we also asked about what was most useful. So these are some of the answers. Some find it hard first time ever, even after watching the video. Some find that the feedback session was useful, history taking was useful. All right, some the evaluation part, they can reflect on the way they manage and so on. Some find the SOAP useful, right? And the analysis was given at the end of completing the exercise, so some find that useful as well. The other question that we asked was suggestion to improve the session, can be more interactive, like some videos. Some were happy with it. Some cancel the questions that asked after evaluation of my just for practice, because some find it a bit tedious. Before they can move, they have to answer the differential diagnosis. So some find it a bit macam susah lah. And some would like what else? Some are satisfied. Some suggest chance to create his or her own question. And these are some other things lah. Difficult to perform the physical examination, make the layout more interesting, discussion, and so on. So troubling because had to click hypothesis every time. So some liked it, some did not like it so much. So these are from the feedback from the students. From myself as a teacher, what I find useful, this software is the symptom-based approach, because it's teach student how to see a real patient, because patients usually don't come with a disease, they come with symptoms. So that actually quite realistic. It's customizable, which is very good. However, it is very detailed. So if you want to customize it, it will be take a lot of work. It's very thorough, which is good. And also the immediate feedback that they give for when you press consult is I think is very good as well. What is not to my liking that much, is maybe a bit difficult to navigate and custom the cases, tedious to go through students' answers. So that's why we came up with the feedback session, so that we can clarify and actually give the take-home salient points to the students from there. And the management approach might be US style, so we are not really familiar with some terms. So overall, I think it's a good software to use, and it is available for us to use. However, it takes some time to get used to it, right? Even us 5 is still learning. It's quite difficult, and also it takes a lot of effort at the beginning. But however, if you do it right, I think after that should be okay for the students to just learn from the case itself. All right. So that's all from me. All right. Okay. Thank you.
Thank you, Dr. T. It looks like it honed on the cognitive skill a lot, thinking process, I suppose. Yeah, rather than actually questioning, because the question is listed out for them to choose. Yeah. With that, it looks like it's about choosing and being familiarized with software that is already existed and we customize to our history. And I'm not sure how many of us are familiar with DXR, particularly those are from Faculty of Medicine. Any question you want to ask about DXR? It looks like it's an introduction to DXR.
Yeah. Actually, some departments I know actually use it. For example, the champion is Prof. Zaliha, of course. So I think ONG is good using it as well, and also psychiatry I know is also using it. So a few departments are using it. I'm not sure to what extent. We are also just briefly using it, not really too much in our department.
Yep. I can see the clinical reasoning.
It's a lot of work.
Yeah, a lot of work. The clinical reasoning bits are how to score them in their ability to reason out their clinical decision on history taking examination as well as management. That quite need a lot of effort to tease out. Are they weak in history taking? Are they weak in physical examination? Is that features available for us to analyze?
To be honest, I'm not really sure because I tak tengok betul-betul that aspect. Actually, for me, I mostly use it for the case and for the history, physical examination, and all that. Not really for the marks itself. To be honest, that's what I do.
Yeah.
So I think if you are interested, that you can learn from the software itself lah.
Yeah. As I was told, I understand that it is allow us to analyze even that deep level of student ability to reason out, their history reasoning. Because not just taking everything history, ask all questions, but ask the right question. That's the beauty of the software. Anyway, yep.
You can limit it.
Any comment and any question? If no, I do have some, but I would reserve that the audience will ask questions. Not so much about the DXR, but PERDEC is another software that I come to know today, a platform that we can use. Dr. Tay are using PERDEC. Is it PERDEC?
PERDEC, yes, PERDEC. Yeah, I wanted to, I'm not sure if everybody is familiar with PERDEC. I actually quite like it. I like PERDEC because it's very interactive. It's something like what Prof. Azhar is doing, but it's already available. So you just do the slides and then give the password. The students can log in and they can write their answers and it will come out in real time. And you can use it as a point of discussion, right? You can not just, you can do multiple choice question, you can drag, you can ask them to draw, a lot of things actually that PERDEC sediakan. I attended one of the sessions and I saw Prof. Mawadah was talking about PERDEC, so I tried it lah and I like it, so I think it's quite useful.
Yep, there are a few platforms available for us to choose. There are many. Yep. Right. If there is no question and comment, I think we will thank Dr. Tay and Prof. Azhar on sharing experience of teaching clinical. Although this is a bit of cognitive thinking mission, involves psychomotor, meaning that we need to ask, able to ask questions, practice that. That probably will look at how we can do it in future. Right. If there's no further comment, I thank both of you and we will call the session to close. And this video will still be available and you can share it. Okay, the secretary will share the video with participants and you can share it with your colleagues. Right. Thank you very much and we welcome your participation. Yeah. We'll have more in future. Series 3, 4, 5, 6, 7. Right.
Thank you.
Right. Bye.
Bye.
Stop recording. Stop. Stop Facebook. Stop dekat tu. Stop. Stop. Yes. Jap. Okay, Prof. Recording still record.
Recording stopped.
Stop.
Okay.
So, Syam and Afiq, thank you very much. Tak tahu macam mana Facebook raise so people around still. Can we ask them to leave?
Boleh. Saya tak boleh move. Sekejap Kita boleh kick lah.
Invite.
Siapa nak ada dalam ni?
Sekejap. Host ada host.
Hai, jap.
Kau kick tu.
Ya, can terminate it.
Okay dah.
Okay dah, settle.
Thank you very much, Afiq. Pagi tadi saya Syam ada email saya rasa team ni rasanya kita elok nak jumpa Berkala tak? Berkala Syam kata okey. Berkala maksudnya mungkin ada problem yang kita dah jarang jumpa sekarang kan?
Boleh tak ada masalah, Prof?
Boleh, no problem. Sekurang-kurangnya kalau kita jumpa